Hello, and welcome to Wine or Whiskey, What's Your Work? Where we sit down with a wine or a whiskey and talk to someone who loves their job. Tonight, we're chatting with Sarah, a physical therapist.
Hello.
Hello. Physical therapy was listed as one of the top in-demand jobs for 2020 by CNBC. On ONET Online, it has an interest inventory of SIR, which is for social, investigative, and realistic. So social occupations frequently involve working with, communicating with, and teaching people. These occupations often involve helping or providing services to others. On the investigative side, those occupations frequently involve working with ideas and require an extensive amount of thinking. These occupations can involve searching for facts and figuring out problems mentally. And then the realistic occupations frequently involve work activities that include practical, hands-on problem solving and solutions. They often deal with plants, animals, real-world materials like wood, tools, and machinery. Many of these occupations require working outside and do not involve a lot of paperwork or working closely with others.
And Sarah, you took the ONET Online My Next Move interest inventory and also came out with an interest code of SIR, making physical therapy the perfect fit for your interests. So tell us, growing up, did you always want to be a physical therapist?
Truthfully, I didn't even know physical therapy was a thing until about high school. I always knew I kind of wanted to do something in the medical field, but I'm terrified of needles. So pretty much nursing, like phlebotomist, any of that kind of stuff I couldn't really do. And I didn't want the overall like stress and pretty much variable hours that like doctors had. So I pretty much was like trying to search for something else. My sister got injured quite frequently. I have a twin sister, and she got injured a bunch, and I ended up going to her physical therapy sessions. And in high school, I was like, I could do this. Like, this is so much fun. I love being active. I love being with people. You investigate, you determine kind of the diagnoses, you figure out the treatments and stuff, and then people get better. Like, what could be better than a job where you make people better? So I ended up kind of switching into that. And in college, I took a pre-physical therapy course to see if it was something I was interested in, and I just fell in love.
That's awesome. Is that kind of the why you went into physical therapy? Was that class or something else?
It was more of my family. I wanted to help them out too. So I have a specialty in scoliosis. And one of the reasons that I went into physical therapy was to help my family out for back pain, hip pain, those sort of things. Like everybody gets some sort of pains. And it was kind of a way that I could, give back to them as well as, help myself too and remain active, since I really like working out and just going outdoors, hiking, those sort of things. So it was a way for me to be active and, help other people.
Awesome. So how did you get the job that you have?
So I work at a outpatient facility that, patients come to me. And I actually work at a place that I had one of my clinicals for school. So one of my clinical instructors is my coworker. He is awesome. He's probably like the greatest person ever. So it's so much fun working with him. And every time that I do something, I'm like, well, you taught me that way. So it's really fun to do that. But it was just a great facility. And since it works with back pain specifically, just was a great fit for me, since that's exactly what I wanted to do. I wanted to do back pain, scoliosis stuff, and I work mostly with neurological disorders, so spinal cord injuries, strokes. So I work a lot with, pretty debilitated people, as well as people that are, dealing with chronic pain syndromes where if you look them, you'd never know that they were hurting.
Do all physical therapists work with that same type of patient?
Not every physical therapist works with that. There's a bunch of different kinds of physical therapy. You can work in the hospital, so the acute care, so getting people up from the ICU, people that had strokes. You have cardiac rehab or pulmonary rehab. There's aquatic therapy. Prior to COVID, I was actually doing 1 day a week in the pool, which is awesome because it's a 93-degree pool and we have underwater treadmills. So you can actually go like run on the treadmill and stuff underwater. And you can like, do a bunch of stuff for like people that have chronic pain, or if you can't move, like spinal cord injuries and you can't move your legs, people are able to move them in the water. So it's a really cool kind of adaptive way. So I do some pool therapy, but not everybody does that as well. Some physical therapists do wound care or lymphedema, so like the swelling management. So after cancer treatments, some people have like swelling in their arms or other kind of conditions. They have certain massage as well as wraps that you can do that physical therapists are trained in. I'm not trained in that, but it is something that you could do. And pediatrics, I don't work with kids besides just the scoliosis ones, so I usually don't see anyone under the age of 12, I'd say, but the age range from 12 to 102. I think 102 is the oldest patient that I've ever seen.
Cool.
She was really cute. And then another one that you could do is sports therapy. Some people specialize in golf or baseball or something like that. There's different mechanics that you can learn. Home health, where you actually go to a patient's house and do the therapy for them, for people that are either homebound or just don't have the transportation, those sort of things. You can kind of like go to their house. School, there's always that physical therapist at your school that, twist an ankle, you go to them, make sure that everything's good. Hand therapy. So if you cut your hand or some sort, like you can get a specialty in hand therapy. Oncology. So when you're recovering from cancer treatments, as well as pelvic health. So pelvic health, it used to be called women's health, but they changed it to pelvic health since males have just as many problems as females with urinary incontinence and like bowel and bladder issues. So physical therapy kind of helps with those issues too.
Wow, it sounds like there's a lot of variety in the work that you do. What's like a typical day look like for you?
So typical day is I actually work 4 10-hour shifts. So I'm there for an extended period of time. So I, drive to my clinic, look up my patient list for the day, do some research on kind of like what equipment I'm going to be using, what kind of modalities I'm going to be using. And modalities, I mean, if I'm going to be doing like massage, ultrasound, the electrical stimulation kind of TENS unit, if I'm going to be using any of the body weight assisted equipment that we have at our facility as well. So for helping with gait training, so walking, I'll kind of go through that kind of list. Then I'll see probably about 10 to 15 patients a day in half an hour to an hour increments, depending on what diagnoses they have. So a lot of the times with kind of pain or kind of simple orthopedic injuries, kind of like an ankle sprain, those sort of things where I'm just giving straight up exercises, we go through them, do some exercises, and then here's your homework, send them on their way, kind of let them do their thing. So that's usually just a half an hour. But people that are like heavy strokes that might need 2 or 3 people to even just get them out of a chair, we might take an hour because getting up might take 20 minutes. So depends on kind of those diagnoses and the severity of their conditions.
Thanks.
And if that's a typical day, what does an extreme day look like in the office?
Extreme days are ones where every single person shows up, because let's be real, not everyone shows up. So even
As far as patients or staff?
both. So, if someone's sick, you sometimes have to start juggling people that you may have not seen before, or diagnoses you may not necessarily be the most comfortable with. But like most physical therapists are trained in a general, we can pretty much treat everything, but there's things that you just like a little bit more, know a little bit more about. So, if you're treating things that you're not necessarily, oh my gosh, I've got to research this before I see them sort of thing. Those get a little bit stressful. Also, people are dealing with different amounts of problems. So whether or not they come in and they just had their medications and they didn't eat any food and they're nauseous, there's dizziness, lightheadedness, there's monitoring their vitals. I've had a few patients that were essentially in an AFib or having issues with their heart, and monitoring them is kind of stressful to make sure that, they're not going to go into a cardiac event while you're working with them. So those tend to be more of my extreme days where you're looking for red flags. There's new symptoms, people aren't getting better, or just that overall busyness. If someone's fainting on me or something, I don't like leaving them and going to go see my next patient, even though their time is up. So it's kind of like, trying to play that catch up. And it's with HIPAA too, like you can't say what's kind of going on. So you may be running late and it's kind of just like, I'm sorry, I'm running late. I can't tell you that my last patient, had A, B, and C happen, so kind of just trying to navigate some of that can be stressful and make it a little bit more of an extreme day.
Wow, I'm sure. So what kind of skills do you use maybe on the average, and then maybe even to compare it to an extreme day?
Yeah. So the funny thing is when we did that, skills test thing, the, communication, those sort of things, like those were like the main things I use. So like, good relationships with people. You have to be really good at reading people, being able to, motivate people, because exercise isn't always fun, especially when you're hurting. So being able to be like, it's okay, this isn't going to hurt you, because some people are just afraid of movement because they've had years and years where they were told don't do this, and now I'm the one being like, okay, we're gonna do this. So using those communication skills is a huge part of it, as well as the investigative portion, like that brainstorming, figuring out, diagnosing. I've seen people that have had pain for 12 years and, we've gone through, the gambit of different stuff. And then we try one thing and light bulb goes on and we're like, this is it. Like, this is why you have this problem. If we fix this, the endless possibilities, of just getting better. So, using those investigative things, I use that all the time. And if someone isn't doing well or the exercises you do aren't necessarily, congealing with their lifestyle, it's always one of those things where it's just like, I don't have a setup for this. And you're like, well, what am I going to do now if they can't do this exercise, which I know will make them better? How can I adapt it for their home environment, whether they don't have like a good counter to stand by or enough floor space to do exercises or even getting off the floor, trying to be able to adapt to that. So using those clinical reasoning skills are huge.
And what education is required to be successful as a physical therapist?
So for physical therapy, you need an undergraduate degree. I actually had a degree in nutrition. I decided that if I couldn't get into physical therapy school, I was going to be a dietitian. So that was my backup plan if I wasn't going to do that. So I got my degree in nutrition, and then you go through a doctorate program at an accredited university, which is typically a 3-year program that includes clinical rotations, and then you get your doctorate. So it is now officially a doctorate program.
Very nice.
And you also talked about having some certifications.
Mm-hmm. So I have a specialty in scoliosis, which is by the Schroth method. It is a German method that does some breathing and posture to help with scoliosis specifically.
Do you see me adjust my posture as you mentioned
I
that?
do.
It's like one of those.
I do a lot of training in posture.
Well, look over here then.
And we talk about you having a doctorate of physical therapy. There's also a physical therapy aide that's also a very in-demand job right now. Can you tell me what the difference between the two is?
Mm-hmm. So physical therapy assistants or aides, they have a associate's degree. So a 2-year degree, it usually is like 5 semesters. They are trained specifically in the progression and regression of exercises. So they usually work underneath, well, they have to work underneath a physical therapist. And depending on the state, there's a certain amount that essentially I can supervise, as a PT itself, but they are the experts in exercise progression and regression. So in school for physical therapy itself.
When you say exercise progression and regression, what does that mean?
So like, if you're doing better, these are the exercises to work this specific muscle and get that better. So progressing it. Or if they're not doing as well, like, dumbing it back down or making it like changing it and adapting it to make it easier and more adaptable for the patient. So they are the expert in essentially monitoring to make sure that the plan of care is being followed, making sure that the exercises are being done appropriately, because not everybody does exercises correctly. Not everything is, if you do a sit-up or something like that, or you do a push-up or lifting your leg, it's not all equal. So depending on how you do it, how your body twists and turns, you can adapt. So they're experts in like that positioning and, getting people to, do the correct positions and exercises. And I'm the one that makes the plan, figures out the different diagnoses, and they're the ones that help monitor in between. So they're my huge cohort and like partner in crime with it. Like, it's so much fun working with them because they have such specific talents with the exercises. In school, we go through like, these certain exercises will strengthen this muscle, but we don't really go through like, okay, well, if we want it to be easier, this is what we start off with. And then this is the next exercise. This is the next exercise. For physical therapy assistants, they go through like that progression really specifically. Like, I know what muscles groups to kind of work on and what exercises work them, but they have that in-depth kind of education in that.
Okay, so if I'm a patient and I come into a physical therapy office, and I would maybe see you first, and you're like, you have zero core strength, and you would then potentially, I'd go see a physical therapy aide that would be like, okay, we're going to start with, can you stand? Okay, now let's try to do a sit up. Okay, now let's try to do a V up. That type of thing.
Yep. I usually set the plan, and then they would essentially work through my plan of care that I had started. Sometimes you just see a physical therapist just in general and go through the progression, depending on if they have specialties. Like, I'm the only one in my clinic that has a specialty in the scoliosis. So they don't know those specific exercises. So like, I would be the ones to kind of see it through that. So it kind of depends on what things they're specialized in, because they can get specialties in, the lymphedema, in essentially like neurology. Some people have specialties in certain sports. So depending on kind of like what you're seeing, any physical therapist or physical therapy assistant could specialize in anything.
Got it.
Interesting. So I'm kind of even curious, a random thought that you had mentioned about like doing the exercises at home, and not everybody does their exercise at home. And being one that's done physical therapy in the past, how can you tell, and how well can you tell if somebody has or hasn't done their exercise?
Yes, that is the question. So a lot of the times you can tell if someone's not doing the exercises because they'll tell you. Like, people are actually a little bit more forthright about it. They're like, I just didn't have time. Like, this just doesn't fit, or something like that. They're not getting better. That's a huge one. Or when I do the same exercise, like, a week later, because it's usually you see them like once a week or once every other week or something like that. If in 2 weeks you can't do any more, there's either something going on that, it's clearly exercise isn't working, or you're not doing the exercise. Because I expect a certain amount of progression or ability for that muscle to either contract better, like, decrease pain. Because like, when you stretch, you should see progression on like, how far you can touch your toes, like you expect a certain amount of essentially movement depending on what the exercise is.
Interesting.
So you can tell a lot, probably more than people think. We kind of can tell. And you know what? It's okay if you don't do the exercises every day. Like, life happens, but if you're not going to do them, you're not going to get better. So
absolutely. And even if you're going back to like your education, what could somebody that is looking at physical therapy expect for like a salary, even like a range from top to bottom or anything like that?
I believe that the mean for Minnesota is about, I want to say it's 84,000 a year. I think that starting off, you can get around, I think it's like 66 or 67,000, and the upper range is about 105 or 106 a year. So it kind of ranges depending on your specialty, depending on, what setting you're in. Some settings you get more. So for like, acute care, you're going to get different ranges than like an outpatient sports kind of place too. So that kind of all ranges, but in general, it's about around that 84, I want to say.
So, would you expect like the acute care to be pay more because it's more complex cases, or does it
It
pay
can.
less?
Yep.
Okay.
So a lot of like in the ICU and stuff, you'll expect a little bit more for that. But at the same time, if you have a specialty in essentially like golf training or something like that, and you know you're well known for that, you might be seeing higher level athletes. One of my clinical, not my clinical instructors, one of my teachers in school, she was the physical therapist for a rugby team, and she actually traveled worldwide with them. So like that is going to be a different salary for like, you know, a little bit more comparatively than just going to like the outpatient kind of clinic salary.
Cool. And so, what's the expected career growth? Like, you come out of your doctorate degree, you get your first job as a physical therapist. What do you do for the next 30 years of your life?
Right. So hopefully you're still doing it. So it can be very demanding on your body, but as a physical therapist, you kind of learn how to lift and move your body, hopefully in a correct way, so you're not hurting yourself. Because if you're seeing someone in the acute care setting where you're doing a lot of lifting of, you know, heavy body, like, you know, if someone is essentially in a coma and you're doing range of motion on them, that's dead weight of possibly hundreds of pounds. That's going to be really hard on your body, and you probably won't have a huge longevity in that. But a lot of people end up transitioning to research or education or even more of the administrative roles. I actually was a director of rehab after my first job. So I was at a skilled nursing facility and I became the director of rehab there. So like, you know, you usually transition into kind of those administrative roles kind of as you go through, as well, to, you know, progress through. Also, depending on kind of what specialties that you get, every 2 years you have to do a certain amount of continuing education hours. Depending on your state, that's going to be different on how many hours you need and what other requirements that you have. But you have to keep up on your continuing education because every year it changes. Medicine is a constantly evolving being of what helps and what hurts, especially when it comes to like certain diagnoses. Like they're coming up with new exoskeletons to help people walk. So learning, like, those are so much fun. Like I could go on about those, but you know,
How close are we to those?
like they actually have them. Like,
Right. But like,
yeah,
how close to them? Like, I might see someone walking down the street with one.
they're really expensive, but you can. I have two patients that I've seen have them, but I don't know
Like,
where they walk. So you could probably could see them. They're in
like it could be
Minnesota,
tomorrow.
possibly.
Like,
Yeah. They're just
awesome.
expensive and bulky right now. And depending on the essentially balance of the patient too, like it doesn't necessarily always work. It has to be like a really specific, you know, this muscle group, you know, those sort of things. But some of the prosthetic stuff that's coming out is really cool. The microprocessors and the prosthetics make walking so much easier. Like you can go up and down stairs now, because before you couldn't, because it would lock when it was in extension, and you can't put weight through a bent, like, you know, you can't put weight through a bent knee. So being able to like step down a stair, so cool. Like it actually will, like the knee will lower naturally. Like there's so many cool things that are coming out with just the microprocessors that make walking so much easier and more natural, that you wouldn't even know that they had a prosthetic unless you know lifted up a pant leg or something.
That's really cool.
Super cool.
And I know we talked a little bit before we started this conversation about there's other types of therapies too that kind of seem like they overlap, like occupational therapy, recreational therapy. Can you talk to us about what are those kind of related occupations
Mhm.
that people might be debating between when they're thinking about their career path?
Absolutely. So physical therapy is one of them, and it's more of what I think of as large body movements. So like gait training, those sort of things. So like full body, big arm movements is kind of what physical therapy is. Occupational therapy is essentially the activities of daily living, how to get dressed, how to do a button. We have a driving assessment in our facility too, where they've got like a digital, essentially like car that you can go into and, you know, practice driving for people that have had concussions or vision issues, strokes. So like that's more of an occupational therapy. Like, can you make toast or something like that? Like if you have a cognitive issue, or if you've had a stroke, can you get dressed? Can you, do those things, activities of daily living? So occupational things. Also for speech therapy, that's also something that's very related. So that kind of overlap with the cognition. So if you have difficulty swallowing, if you have difficulty talking, if you have a stutter, those sort of things, you can kind of go through the speech therapy component too. Then we also have recreational therapy, which is, getting back to activities that are fun. So finding resources and allowing people to not necessarily do a sport, but other things of recreation. So like, sports are definitely one of them, but whenever anyone hears recreational therapy, they think of like, let's get back to sports, but it's, being able to do crossword puzzles, going into the community and doing volunteer work or something. So like being able to do those things. So that's like another subset.
Interesting. So I am kind of curious too, even for like parting thoughts and words of wisdom that you might have for our listeners, what might those be if they want to pursue a career like this? What would you tell them?
If you'd like to pursue anything in kind of the therapy world, I'd say you have to like people. So make sure that you have a passion for people. And I think that for physical therapy in general, do your research. I really liked taking that one class that I had because it educated me on the fact that there were so many different things that you could do for physical therapy, that I could go into research, that I could go into education, that it wasn't just that orthopedic version that I thought was all of physical therapy. So, my sister got her knee injured and I thought that was what they did. I just thought they fixed hip, knee, shoulders, those sort of things. But there's so much more into it. So finding your niche and being open-minded about it, because I found out that I really liked different areas that I didn't think I would. Like I really enjoyed the neurology world that I'm in right now. So the strokes and those things. And I really didn't think I would like it. I really thought I'd be a complete outpatient ortho. I thought I would do more of the acute care kind of hospital stuff, but being open to those opportunities as they arise, you're going to have a lot more fun because it just changes daily. So you're not doing the same thing.
Awesome. Well, thank you so much for your time today. And I hope our listeners learned so much from you. And it's cool to see someone who's so passionate about helping people. I would definitely come see you as a physical therapist.
Ditto.
We'll treat all of you. I will make you all better and I will work on your posture. How's that sound?
I got new posture things on my
Good,
chair.
yeah. This working from home thing has been super hard. I see so many people with like back and neck pain, and it's been essentially like, the staring at a screen. Like the working from home has been killer. Like our body is not made to do that. So I see a lot of it, and just.
So what's the 3 tips you have for people if they're working from home? What do they have to do?
If you can, standing desks are great. I know that it's terrible, but they're pretty awesome. Make sure that your screen is at eye level so that you're not, especially laptops, that tends to be kind of a big one where you're always looking down because it has to be on the table sort of thing. So eye level. So that's, standing desk if you can, eye level, and then making sure that you get up like every 20, 30 minutes, like every hour, put an alarm on or something, and then just get up and go get a glass of water or something. Doesn't matter what you do, but like as long as you just loosen up, bring your shoulders back, moving the head back and forth, whatever you can do to get moving throughout the day, like continuously throughout the day is better. Because even when you're at like the workstation, you're probably talking to people, you're getting up and, going to the bathroom, those sort of things. But at home, you have everything kind of right there and nobody gets up. And then you're there for 8 hours and you don't move. And it's so bad for you.
It reminds me of that whole philosophy and that saying, a body in motion stays in motion.
Exactly.
Yeah.
Well, thank you so much for your time, and cheers to physical therapy.
Cheers.
Cheers.